So we know that independent living can be like senior housing, and uh, we know that those apartments are just a little more expensive. Respite care provided by Medicare doesn't cover a lot, but it is available. Home care, it is just astounding how expensive that has gotten. Uh, are we talking about $30 to $40 per hour? Who can afford this? Um, and then there's adult day health care. There are day programs at a number of our senior centers, and I know Silverado and other facilities offer the day care program. It's a good option for cost savings, and it is a safe alternative as well. Assisted living, my goodness, it ranges from say $3,000 to start on to $25,000 at these luxury, lovely hotel resort settings. But it can also mean the residential care facilities, the boarding care, the homes with maybe 5 residents and the caregivers. And even that has exploded. That starts at about $3,000, can be about $10,000 a month. Shamefully, memory care is extraordinarily expensive. I understand that our memory care units start at about $15,000 and are, as far as I know, capping out at $25,000, but it might be more. And then we have our skilled nursing home. Skilled nursing home is about $20,000 a month. But this is also where we have the most help from public benefits. And that's the program I'm going to be focusing on the most. And the other program we have, of course, is hospice. Now, that is not placement, but that is basically palliative care. The interesting thing about hospice is it used to mean something very different. Hospice used to mean you were certified that you would be passing away within 6 months. But, we've noticed that people get better on hospice sometimes, that people graduate hospice, so to speak, because of the intensive treatment and care. Hospice merely means you're not being treated for an illness, you're just being treated for comfort and care. So, how are we going to pay for all of this? This is really expensive. Well, in our current system, mostly we're going to pay for it ourselves. There's always the home. Now, reverse mortgages are terribly expensive. And the thing you've got to know up front is once you're no longer in the home, that loan comes due. And these are terribly expensive loans. But for some people who are trying to stay at home and pay for in-home care, it can be a very good option. More and more of us are looking at long-term care insurance as a necessity. Unfortunately, most of the folks that I see who have it are the public employees because it's offered through their employment, but very few others have invested in it. The other thing is there's not many companies in California that continue to provide it because they found out people actually use these policies and they actually have to pay out on these policies. So I believe there's only 6 of them left in California that offer long-term care insurance. The other thing is we have to start investing in this a lot sooner. The rules used to be that maybe in your 60s, maybe in your 70s, well, you can't even get it if you wait that long. The new rule is you have to start investing in a long-term care insurance policy in your 40s and 50s if you're going to get a good rate. And lastly, and this is true for many, many people, public benefits. We're talking about Medi-Cal to help pay for the cost of care. Veterans benefits. Oh, for goodness sakes. There's so much that the VA offers, but there is a limitation on its availability. So for those veterans who are eligible for VA pension, I definitely recommend making an appointment at the Veterans Service Office. You know, there's one right here in Santa Ana, and they do a wonderful job of ushering you through the process of the aid and attendance, the home housekeeping, and making sure that your veteran receives all the pension benefits that are necessary for their care. One of the limited programs, I don't know except one person who ever got it, but they do pay for long-term care in a skilled nursing home. It's lovely if you can get it. What does Medicare do? Well, it pays for your hospitalization, right? That's Part A, and Part B is for your regular outpatient, and then Part C is a supplement, and Part D is for your medications. It's just an entitlement. You get it no matter what, so long as you have eligibility for Social Security. But it doesn't pay for long-term care. It does not pay for long-term care. It does not pay for it. So, you know, you have the hospitalization and then discharge, sometimes to a rehab. And yeah, Medicare will pay for it up to about 120 days. But there's a copay of presently, I believe it is $200 a day after day 20. But nobody even gets the full 20 days of complete coverage, because after about a week, they say, okay, you're ready to go. You're being discharged to home. And if you say, oh, but they need further care, well, then you're going to be paying that daily rate out of pocket. So let's talk about Medi-Cal. This is our program that assists us with long-term care. I'm going to focus most of my attention on long-term care because, well, that's the program we've got that's most funded. I want to mention that we have IHSS, in-home supported services, and that provides care in the home, but they don't give nearly enough hours, and the amount per hour, I believe right now is $15 an hour. We just said that in-home care costs about $30 or $40 an hour. So you can see it's not enough. Secondly, we have the assisted living waiver program. Wonderful that you can get placed in an assisted living and Medi-Cal might pay for it. The problem is there's very limited beds. Very few assisted living are participating in the program. And there's a 2-year wait list. And there's a very strict income level. The income cap for the assisted living waiver program is, I believe right now, $1,600. To qualify for this program, you must make $1,600. But again, there's a 2-year wait list. And right now, I don't even know anybody who's on it. So our rules and our laws are skewed towards putting people in nursing homes. The least desirable level of care, but that's what we have in California. All right, so I'm going to tell you how to be eligible. As we're nearing time, I had mentioned that the in-home supported services and assisted living waiver program, you can qualify having income of less than $1,600. But I want to tell you about long-term care because that's the program that is mostly available. So to qualify medically, you have to have deficits in activities of daily living, bathing, dressing, feeding, and most important, walking and going to the restroom on your own. Those are the thresholds to get into a skilled nursing home. But here's the news that I need to share with you. People used to think that they had to give away all of their money and property. This is brand new this year. As of this year, a person can qualify with unlimited income. That's, whatever comes in the month, and assets worth up to $130,000. And that's for a single. If you're married together with your spouse and qualify for a skilled nursing home, you can have a total of $278,000. That's new this year. It used to be $2,000 plus $130,000. To qualify for Medi-Cal for long-term care, a married couple can have a home, a car, unlimited IRAs, and up to $278,000. But I'm telling clients right now, don't do any radical planning for long-term care for a skilled nursing home, because guess what? Next year, the rules are changing again. Next year, there's going to be no asset limit. None, no asset limit. That tells me that our state is gearing up to put everybody in a nursing home. Astounding. So I said you can have, as a married couple, $278,000. And what are the assets that we're talking about? Well, there are certain exempt assets. And I said your home and your car are exempt assets. And your IRAs, your annuities, your 401k, anything that's paying out, like the required minimum distribution, that is not counted. So what is counted? Any bank accounts, investment accounts, stocks, bonds, CDs, anything that can be liquidated to provide for your care. And that can often mean second real estate properties or other vehicles. So income. Medi-Cal isn't free. Medi-Cal will charge a share of cost, and the share of cost is whatever your income is. So if you are a married person, your spouse keeps all of their income, their Social Security, their pension. But if your spouse makes less than, here's the magic number this year, $3,716, they can keep a portion of your income, but the rest gets paid to the facility as share of cost. Medi-Cal is not free.